Viewers, welcome back to the on DDM Health News Updates. Under our program, Your Health, Your Wealth. As a reminder, listeners, don't forget to subscribe to our YouTube channel, Diaspora Digital Media, to get the latest health news updates. So what do we have today? In a bold move to strengthen cancer research and improve treatment outcomes across Nigeria, the federal government has launched a comprehensive training program targeting 120 young researchers from across the 6 geopolitical zones of the country. The initiative, titled Strengthening Institutional Capacity for Cancer Research and Implementation, SINCA, aims to address key gaps in cancer research through sustainable institutional support, human capacity development, and evidence-based practices. Speaking at the official launch in Abuja on Wednesday, the Director General of the National Institute for Cancer Research and Treatment, NICRAT, Dr. Usman Aliyu, described the program as a strategic intervention focused on empowering the next generation of oncology researchers. According to Aliyu, Nigeria is currently grappling with a critical shortage of cancer researchers, with African nations contributing less than 1% to global clinical trials. This, he said, has hindered the development of innovative therapies suited to local cancer partners. The intervention, we are working on sperm prevention, development of effective screening tools, and identifying Nigerians with early stage cancers, he said. Research is also vital in designing diagnostic tools and new therapies specifically tailored to the types of cancer we encounter most frequently in Nigeria. He further noted that the SINCA project will be implemented nationwide and will place a special focus on genomics, a cutting-edge field that can help unlock precision medicine and treatment protocols unique to Nigeria's cancer burden. Also speaking at the event, the Director of Research and Innovation, Dr. Nwamaka Lesibikan, highlighted the project's vision to promote evidence-based policymaking and practical public health solutions derived from homegrown research. We no longer want research to end on the pages of academic journals, Lesibikan stated. This program is designed to solve real problems, create economic value within the research ecosystem, and improve healthcare delivery. She revealed that the 120 participants were selected from a competitive pool of over 500 applicants nationwide, with 20 representatives drawn from each of the country's geopolitical zones. The group includes medical doctors, basic science researchers, lab scientists, and computational science experts, ensuring a truly multidisciplinary approach. According to her, the trainees will be exposed to key priority areas including genomics, health outcome research, and implementation science. Wow! Upon completion, participants will develop concept notes and formulate national research questions tailored towards impactful cancer solutions. Cancer must go, naim be the thing. She also announced that outstanding participants would be placed in a year-long mentorship program to help them implement grants and apply the knowledge gained in real-world settings. One of the participants, Nana Lawal, or an oncology nurse educator from the National Hospital, Abuja, expressed her enthusiasm about this opportunity. That's great. Our main objective is to improve nursing care for cancer patients, and by focusing on preventive research and symptom management, she said. The News Agency of Nigeria, that's NAN, reports that by the end of the training, participants will have acquired a robust blend of qualitative and quantitative research skills, alongside hands-on experience in data analysis and management. The SINCA initiative is expected to catalyze a new era of cancer research, policy reform, and improve patient care across the nation. It will really be a great thing that cancer is being eliminated. Next, in a significant boost to healthcare access in Nigeria, over 800 residents of Lagos have benefited from a free medical mission facilitated by the Association of Nigerian Physicians in the Americas, that is the AMPA, in collaboration with medical professionals from the United States and Canada. The initiative, which recently concluded in Lagos, saw the deployment of more than 140 volunteer healthcare workers who provided critical services to undeserved community. Wow, so thoughtful of them. Speaking in a statement made available to Punch online on Wednesday, Chair-elect of AMPA's New Jersey chapter, Dr. Emmanuel Emesaboa, described the outreach as a major milestone, especially with the successful conduct of the first-ever gastrointestinal procedures during a medical mission in the region. This year's mission wasn't just about medical treatment, it was comprehensive, Emesaboa said. We provided general consultations, life-saving surgeries, dental care, vision screening, gastrointestinal procedure, and several health education sections to all the patients. The medical outreach was held at two major facilities, that is the Lagos University Teaching Hospital and the Federal Medical Center, Ebute Metta, that is the FMC. According to reports, patients began queuing at the centers from as early as 5 a.m. daily, many of whom had previously postponed care due to financial hardship. Among the beneficiaries were children, the elderly, and the adults with long-standing medical conditions. Dr. Emesaboa, who also led the internal medicine and cardiology team at FMC Ebute Metta, revealed that the mission offered a wide range of specialized services, including cardiology evaluations, internal medicine consultations, and physiotherapy for patients battling chronic diseases and musculoskeletal disorders. He stressed that the outreach went beyond temporary relief, with deliberate efforts made to enhance local healthcare capacities. Workshops were organized for Nigerian medical professionals on best practices and new technologies, he said. In addition, AMPA representatives held discussions with key stakeholders and government officials to explore sustainable strategies aimed at strengthening Nigeria's healthcare system. Every patient we treat and every professional we empower brings us closer to a future where no Nigerian is left behind in healthcare, Dr. Emesaboa noted. The initiative, themed "A Healthier Nigeria is a Healthier World," was hailed by residents and health authorities as a timely intervention, especially in a time when access to affordable healthcare remains a challenge for many. Up next, in a bid to curb malaria-related deaths among children, the Oyo State government has announced a fresh collaboration with the Malaria Consortium to roll out seasonal malaria prevention drugs for over 270,000 children across 6 local government areas of the state. Wow! The initiative, known as Seasonal Malaria Chemo Prevention, that is SMC, is set to run from May to September 2025, targeting children aged between 3 and 59 months in the Sahel Belt region during the peak of malaria transmission, which often coincides with the rainy season. The affected local government areas include Saki East, Saki West, Olurosogu, Irepu, Silurele, and Obomosu South. Speaking during the advocacy, communication, and social mobilization core group meeting held at the Oyo State Ministry of Health, the Oyo State Program Manager for Malaria Consortium, Dr. Taiwo Olarinde, disclosed that the beneficiaries will receive 5 cycles of sulfadoxine plus pyrimethamine and amodiaquine starting from May 29, 2025. According to her, only children who are healthy, not on any sulfur-based medication, not allergic to drugs, and who have not used similar anti-malarial medications in the past 1 month will be eligible to take these drugs. She explained that the medicines would be administered directly by caregivers under the supervision of community drug distributors, who are expected to go from house to house in the designated local government areas during the exercise. Wow. Dr. Larinde noted that since the introduction of the SMC initiative in Oyo State in 2022, there has been a noticeable drop in malaria cases and deaths among children. At the beginning, malaria infanticide in these areas was as high as 62 to 63%, but now everything has reduced. As of February this year, one of the participating local government areas reported a malaria prevalence of 39.6%. She added that Oyo is one of the 21 states flagged from early SMC implementation following the Nigerian Meteorological Agency prediction of early rains in states like Oyo, Kogi, and Nasarawa. In 2024 alone, the program reportedly reached 260,000 with a coverage success of 22%. Olarinde called on world development committees and community leaders to lend their support to the initiative, while also encouraging the consistent use of insecticide-treated mosquito nets to complement the drugs. Also speaking, the state coordinator of the Civil Society on Malaria Control, Immunization and Nutrition, Mr. Segun Adio, harps on the need for a more international approach to behavioral change in malaria prevention. We have realized that a lot of people are still not getting the right information. That's why we must be deliberate and consistent if we want people to adopt healthy malaria prevention practices, he said. On her part, the state's malaria elimination program manager, Mrs. Folanke Adeyomo, said the quarterly ACSM meeting was aimed at reviewing activities and planning for the upcoming 2025 World Malaria Day. She stressed the importance of early detection and treatment of malaria, proper sanitation, and the use of mosquito nets, urging residents to take preventive measures seriously as rains approach. You know, we are truly in rainy season, so the more rain, the more mosquitoes. Finally, the newly appointed Executive Director of Finance and Administration at the Ogun-Osun River Basin Development Authority, Mr. Ayobami Oyalowo, has pledged to enrich accountability and foster collaboration in line with President Bola Tinubu's food security agenda. Oyalowo made the promise on Wednesday during an event marking his official assumption of office at the authority's headquarters. He stressed that collective efforts from all Nigerians are critical to revamping the country's agricultural sector, stating that his office would provide proactive and strategic financial support for the effective implementation of the projects. I am committed to fostering a harmonious and collaborative relationship with the board, management team, and all staff. I firmly believe that synergy across all levels of the authority will lead to outstanding results in achieving our shared goals, he said. The finance boss also reiterated his commitment to promoting a culture of transparency, teamwork, and innovation. According to him, financial prudence, efficiency, and strict adherence to due process will be the cornerstone of his administration. By working closely with my team, I will ensure the judicious use of resources, adherence to best financial practices, and the strengthening of financial controls to enhance transparency and accountability, he added. Oyalowo called on staff, stakeholders, and development partners to work with renewed zeal in advancing the goals of the authority, assuring them of an enabling work environment that promotes productivity. I am confident that through dedication, collaboration, and adherence to best financial and administrative practices, we will drive the authority towards unprecedented success, he added. Earlier in his remark, the Managing Director and Chief Officer, Dr. Deji Ashiru, welcomed Oyalowo and other newly appointed executive directors, describing them as thorough professionals and the capacity to drive President Tinubu's agenda of sustainable water resources management and increased food production. All right, viewers, this will be all for now on our program, Your Health, Your Wealth. Don't forget to click on the like button, share, comment, and subscribe to our YouTube channel. I remain your host, Neyer Michaeline Izinde. Thanks for watching.